A groundbreaking treatment for type 1 diabetes is showing promising results for patients here in Chicago.
It's a minimally invasive procedure that could mean diabetics don't have to inject themselves with insulin.
Our Darius Johnson is live at UChicago Medicine to tell us how it works. Darius?
Good evening, Joe and Erica. There are a total of 3 patients in this trial. One is off insulin. Another is starting to reduce his insulin intakes in hopes of stopping soon. However, you will hear from the third one tonight, who is now living a life she never has before. Here at UChicago Medicine, life-changing transplants are being conducted for type 1 diabetic patients.
This medication has a great potential to be less toxic to the patient and be more beneficial, providing better outcomes in islet transplantation.
That medication is Tegoprubart, modified over the last 25 years to help bring positive results for type 1 diabetic patients who use insulin, patients like Marlena Godell.
I have so much more energy. I feel so free.
For 25 years, she has lived with type 1 diabetes. She calls it chaos from age 5 until now.
I would go to sleep at night and think, this might be my last night. I might not wake up and see my daughter ever again.
She says her tipping point was when her daughter found her on the floor after her sugar crashed. She then talked to 3 doctors about islet cell clinical trials and got nowhere until she researched.
I emailed the University of Chicago and essentially just wrote out my entire life story and just saying, please help, I've had enough.
That was last October, and on July 17th, she went in for her procedure.
I have a really cool scar. I show everybody who will look at it. They just kind of made a very small incision and then injected the islet cells into my liver because, well, my pancreas don't work, so they injected them into the liver.
3 weeks after the procedure, she was off insulin. For that, she thanks her superhero, trial co-investigator Dr. Peter Wachowski.
Her life was severely compromised, and she couldn't live like this anymore.
3 months later, she's living a life like never before, which often includes double cheeseburgers.
It's been great, and I'm just looking forward to helping the other diabetics get their hope back.
Dr. Wachowski really hopes that they can expand the pool of patients so they can continue to provide this life-changing transplant. Since Marlena was not able to achieve her dream of having a horse boarding facility, she is now in school for horse massage and laser therapy, and of course still enjoying those double bacon cheeseburgers. We're live at UChicago Medicine tonight. I'm Darius Johnson. Joe, back to you in studio.
Good for her. What a story, Darius. All right, we'll continue to watch that and hope for the best, as certainly sounds promising. Darius, thanks again.